Liver transplantation. Liver transplantation is a surgical procedure in which a diseased or failing liver is replaced with a healthy liver from a donor. It is a life-saving treatment for end-stage liver disease and acute liver failure. Below is a detailed discussion on the subject under various headings. Introduction. The liver is a vital organ responsible for metabolism, detoxification, and the production of essential proteins. When the liver fails due to chronic or acute conditions, transplantation may be the only curative option. Liver transplantation is considered one of the most complex surgical procedures, requiring a multidisciplinary team approach. Indications for liver transplantation: 1. Chronic liver disease, cirrhosis due to alcoholic liver disease, viral hepatitis, hepatitis B, C, non-alcoholic steatohepatitis, NASH, primary biliary cirrhosis, PBC, or primary sclerosing cholangitis, PSC. Genetic disorders: hemochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency. 2. Acute liver failure, drug-induced hepatotoxicity, e.g., paracetamol overdose, viral hepatitis, acute cases, ischemic liver injury. 3. Liver tumors, hepatocellular carcinoma, HCC, within Milan or UCSF criteria, non-resectable cholangiocarcinoma, selected cases. 4. Other indications: congenital metabolic disorders, e.g., Crigler-Najjar syndrome, glycogen storage diseases, Budd-Chiari syndrome, autoimmune hepatitis. Hash of contraindications: absolute contraindications, active sepsis or systemic infections, extrahepatic malignancies with metastasis, irreversible severe cardiopulmonary disease. Relative contraindications: age 70 years, considered case by case, active substance abuse, alcohol or drugs, advanced hepatic encephalopathy. Types of liver transplantation. 1. Orthotopic liver transplantation, OLT, the most common type where the native liver is removed and replaced by a donor liver in the same anatomical position. 2. Living donor liver transplantation, LDLT, a portion of the liver, usually the right lobe, is harvested from a healthy living donor. 3. Split liver transplantation. A deceased donor liver is divided and transplanted into two recipients, commonly one adult and one child. 4. Auxiliary liver transplantation. A part of the donor liver is transplanted, allowing the recipient's native liver to potentially regenerate. Evaluation for liver transplantation. 1. Patient assessment, clinical history and physical examination. Evaluation of MELD, model for end-stage liver disease, score to prioritize candidates. Psychological and social assessment to ensure adherence to post-transplant care. 2. Laboratory and imaging. Liver function tests, coagulation profile, and renal function tests, viral serology, HBV, HCV, HIV, imaging, ultrasound, CT, MRI for assessing liver anatomy and vasculature. 3. Multidisciplinary team approach includes hepatologists, transplant surgeons, anesthesiologists, social workers, and dietitians. 1. Deceased donor criteria. Brain death confirmed. No evidence of liver disease, sepsis, or malignancy. Age 70 years, preferred. 2. Living donor criteria. Healthy adult individual. Blood group compatibility. Adequate liver volume, remnant liver volume 30%. Surgical procedure. 1. Donor hepatectomy. Extraction of the liver from the donor, ensuring preservation of vasculature and biliary structures. 2. Recipient surgery. Removal of the diseased liver, native hepatectomy, anastomosis of hepatic veins with the inferior vena cava, portal vein to ensure blood flow, hepatic artery for arterial supply, bile duct for biliary drainage. 3. Intraoperative monitoring. Close monitoring of coagulation, hemodynamics, and blood loss. Use of cell savers to minimize blood transfusion. Postoperative care. 1. Immediate care, monitoring for hemodynamic stability, ensuring graft function, bilirubin levels, INR, liver enzymes, infection prevention, antibiotics. 2. Immunosuppression, induction therapy, e.g. basiliximab, antithymocyte globulin. Maintenance therapy, e.g. tacrolimus, mycophenolate mofetil, steroids. 3. Complications to monitor. Early complications: primary graft dysfunction, vascular thrombosis, hepatic artery or portal vein, biliary leaks or strictures. Late complications, chronic rejection, opportunistic infections, recurrence of primary disease, e.g., hepatitis. Outcomes, survival rates, 1 year survival 85 to 90%, 5 year survival 70 to 75%. 2. Quality of life, significant improvement in functional capacity and independence. Future perspectives, advances in organ preservation techniques, e.g., normothermic perfusion, use of bioengineered livers and stem cell therapy, artificial liver support systems as a bridge to transplantation. Conclusion: liver transplantation is a highly effective treatment for various liver diseases, with significant advances in surgical techniques and immunosuppressive therapies improving outcomes. A thorough evaluation, careful donor selection, and meticulous postoperative management are crucial for success. Despite its complexity, liver transplantation remains a beacon of hope for patients with end-stage liver disease.